OIT writing subtest will obviously test writing skills. Most commonly, you will be required to write a referral letter, following the task instructions and using the given case notes. Profession-specific letter. If you are a doctor, you will be writing for a doctor. And if you are a nurse, you are writing for a nurse. And non-doctors and nurses will also get their own chance to write for their own relevant profession. You have 5 minutes of reading time and 40 minutes to write the letter. So you need to use the time wisely. Before you start reading the notes, make sure you fully understand the task and be very clear who you are writing to and why. What do you want them to do? Keep these two things clear in your mind as you read the case notes. Therefore, as you read, you can filter the notes in your head as to which information is most relevant. So, എങ്ങനെയാണ് ഒരു referral letterന്റെ structure എന്ന് നോക്കാം. Situation. This is your opening paragraph and it should make the purpose of your letter incredibly clear. Be very specific as to who your patient is, the purpose of your referral and the urgency. For example, I am writing to urgently refer to this 50-year-old female who has presented multiple times over the past month with worsening symptoms of angina. Please arrange appropriate investigations and manage accordingly. ഈ ഒരു എക്സാമ്പിളിൽ റീഡറിന് ഒരു ക്ലിയർ ഐഡിയ കിട്ടിയിട്ടുണ്ട്, വിച്ച് എക്സ്പ്രസസ് urgency and clearly explains what you as a referrer wants to reader to with the referral. This type of approach should help you score points for purpose and for clarity in the OIT writing task. Timeline. This is the part where you put all the information about what has happened so far with the patient. That is, immediately relevant for this referral. This is likely to represent the main body of your letter and be at least 2 paragraphs. In this section, you will discuss the patient symptom, examination findings, and any investigation results you have. These should be presented in a way to clearly describe the patient's story and how it has evolved. The information can either be presented in a backwards or a forward direction depending on your opinion for each case. For example, with forwards, you would start with when they first presented with relevant symptoms and continue summarizing the case notes up until the most recent presentation. With backwards, you would start with how they presented most recently and mention previous relevant presentations. There is no rule about which is better. It depends on the case which you feel is more appropriate. In general, if referring urgently about an acute problem, start with today's presentation and then say what has happened previously. Remember to only include very relevant information to the reader here. Only things that are directly related to the referral should be mentioned. Background. Here, put any information which has some relevance but it's not key information to the referral. For example, other past medical history, drug history, family history, and social history. Some things in the above categories may be very relevant to the reader. For example, in angina, if the patient is a heavy smoker, has had a previous MI, or has an extensive family history. In this case, I would mention these things in either the situation or the timeline sections. It is also important not to include completely irrelevant background information. If normal, there is no reason to mention the height and the weight of the patient. It can be useful to summarize pertinent negatives here. For example, Ms. Anna is generally fit and well with no significant past medical history or relevant family history. She takes no prescribed medications. She is a non-smoker and works as an accountant. The length of the session will vary depending on the case notes, but it would be unusual for it to need more than 1 paragraph. Recommendations. This is the concluding paragraph to your referral. In this part where you say what you would like the reader to do. This may involve some repetition from the situation. However, aim to change your wording and possibly be more specific. If the case note have mentioned a provisional diagnosis, then if you haven't put it in the timeline section, put it here. It is very important for the exam that you do not try and diagnose the patient if it is not mentioned in the case notes. Make this a short paragraph. summarizing the very key information from the letter and making it very clear why you are referring and what you want the referrer to do. Try to avoid phrases such as "please review for the further assessment and management." While these phrases are correct and used in real life, the examiners want to see that you have interpreted the case notes correctly and that you can build your own relevant sentences. A better example would be, "Please take Ms. Anna under your care for immediate investigation and any necessary intervention." The more specific, the better. The checking stage. Whether in your practice letters or on the day of the exam, it is absolutely vital that you check your work after you have finished writing. If possible, aim to read it over twice. Happy learning!
Needus Academy, India's #1 language academy.